My name is Dr. Carolyn Langford, and I'm a urologist. I'm literally right around the corner. I'm exactly 8 minutes away, according to my GPS. And I appreciate you inviting me to be able to speak with you here. I did not have any idea that this was so lovely inside. I drive by it every day to take my kid to school, and it just looks like a big white building. I didn't know you had this nice courtyard and all of that. So it's a really nice place in here. So congratulations on that. So, but I wanted to talk to you guys about some things that are really relevant to the patients that I see in my office, and particularly for women over 50. Now, since it's only women here, I'm just going to discuss women's problems, but I mean, these things do apply to men in some ways as well. So, let's go get going here. Okay, so I am fellowship trained in female urology and voiding dysfunction from the Cleveland Clinic. And what that basically means is I specialize on things from the belly button down to the thighs, basically. So the bladder, pelvic floor dysfunction, things that can kind of fall down and out that might be in the wrong position, and specifically leakage of bowels and bladder. And that's a very common problem for women, particularly over 50 or after childbearing. Okay, so I want to kind of talk to you about the things that are pressing issues to the patients that I see in my office, and they're really worried about their quality of life. Obviously, bladder health and cancer and things like that are very important, but what I'm going to talk to you today about are about things that improve your quality of life and make things easier for you. So when I have patients that come into my office and they say that they can't make it to visit their family because they're going on a long car ride and they're going to have to stop 5 or 6 times on the way, or that they miss a show, or they can't go to the theater to watch a show because they're going to the bathroom so often, that's the kind of thing we want to deal with here for your quality of life. So also just not even going out because you're afraid you won't make it to the bathroom. So what you should know is that it's not a normal part of aging to have this problem. So just because you get older does not mean it has to be what happens in life. It is very normal to be able to stay continent of both bowel and bladders your entire life. And it's not just a part of being a woman. Not every woman has this problem. It's not just an issue with the prostate. None of you have prostate, so that's okay. And it's not caused by anything you did. You did not cause this to happen if this is an issue for you. Okay. So these are just some ways that it can impact your quality of life. So obviously, if you have leakage, you might decide to be a little bit less physically active. You might decide that you don't want to play pickleball or do the things you normally do, yoga, things that might cause you to have leakage. It obviously makes you a little more self-conscious. If you're wearing a pad or something and you're worried about how it might smell or something like that, it can certainly make it so that you feel a little more hesitant to participate in those activities. As far as intimacy, some women avoid intimacy just because they have some leakage issues. And obviously just the expense and irritation of wearing pads is an issue as well. So for a number of reasons, this can be something that can be bothersome for you. So it's important to know you're not alone. Clearly you're not alone because I have an entire career based on you not being alone. It happens very frequently. So 30 million women in the United States suffer from what's called stress urinary incontinence. And I'm going to go over that with you, but that's a really large number for an issue to occur. Okay, so that's where the 30 million comes from. It's 1 in 3 women. So that basically means that, you know, a third of the women in this room might have an issue with that. And it's not unusual, it's not something to be ashamed of, and it is something we can help you with. Okay, so let's talk about kind of what this actually means. So to understand what stress incontinence is, you kind of have to understand what the bladder does. So the bladder is just basically like a water balloon with a tight neck, and it fills very slowly and calmly. The neck of the bladder or the urethra sits nice and tight and closed with the muscles closed and strong. And when you need to urinate, what happens is those muscles will relax, the bladder can squeeze. Now, if you are physically active and you put pressure on that water balloon, let's say, and the little neck of the balloon or the urethra isn't strong enough to hold it, you will leak. So when you cough, when you sneeze, when you go from seated to standing, if you're doing any kind of exercise, you can have some leakage. So that's stress incontinence. It's really something, it doesn't usually happen when you're laying flat in bed. It really only happens when you go from like your feet hit the floor and then you can't make it to the bathroom because you start to leak on the way. That is a little bit to do with the stress incontinence issue. So it's kind of an anatomy problem that the valve isn't tight enough. So the good news with this is we have some really good therapies now that are advanced far beyond what they might have told you about before, that are very safe to use and very simple to do as well. So when we're dealing with stress incontinence, the leakage with cough, sneeze, and physical activity, we really can do a few different things. So first, obviously, you can try to do some pelvic floor physical therapy and exercises. That's where you're just tightening those muscles around. Everybody's heard of Kegel exercises. I'm sure after having children, or you have friends that have had children that have told you they've been told to do these exercises. That helps to tighten the muscles around the tube. It does not help to plump up or tighten the tube. It just kind of works around the tube. It's a great place to start, but it might not be where you need to end up. The next option that traditionally was available were mesh urethral slings, or even slings that were made out of biologic tissue. And you may have seen on TV, there are a number of things about vaginal mesh and things like that. That's not exactly what we're talking about here. This is just a little strip of a polypropylene mesh that goes under the urethra and tightens the urethra to hold it up. It is a surgical procedure, and it does require some recovery. So if you're given a choice of doing something that's very simple or a surgery, we always emphasize trying to do something that's a little simpler and a little less invasive. And that's where we would be talking about the urethral bulking agents, which would be what I'm going to talk to you about today. So again, we mentioned the Kegel exercises, kind of getting down, doing some pelvic floor physical therapy. Many of you may have done it after childbirth, but it can be done all throughout life, and it really does help things. 85% of people that do some physical therapy do have improvement. The question is, do they get far enough? Is it making things tight enough so you're able to hold things, hold the urine in? Okay, this is the surgical sling I was talking about, and basically, is there a pointer on this? Yes, okay. So this is a little piece of mesh that goes under the bladder, your neck, the urethra right here, okay? And it just takes the urethra that's loose and tightens it up. It kind of creates a little kink to hold things in. It is considered the gold standard. We have good follow-ups showing that it works well. It's got an 80 to 90% success rate. But again, it is a surgical procedure. And when we do that, you have to heal from the incisions. Okay, so what's really nice in urology now and with leakage is that we have a really good bulking agent. Now, many of you, I don't know if you recall or have any experience with this, but a long time ago we used to do things called collagen. They were just the collagen, bovine collagen, or the collagen you would have in your own skin, and we would plump up the urethra, but it would last for 3 months. So you'd have to come back every 3 months to get this procedure to tighten the urethra. Then we went to some options that were made out of carbon. We went to options made out of calcium, and then something called macroplastique. And all of those were things that cause inflammation and irritation. Now we have something which is called Bulkamid, which is what I'm talking to you about today, and that is very natural and not anti-inflammatory. It's actually really 98% water. It really actually has a little polyacrylamide gel in it, and it is a plumping injection that doesn't cause that inflammation. It's very natural and kind of soft and pliable like your own urethra. So it is injected into the wall of the urethra. So as you saw, the sling went under the urethra here, but this goes around the urethra, and these little balloons that we kind of create in the urethra. It takes just a few minutes to do and has an almost equal response rate, and people are very satisfied with it. So let's kind of go into it a little bit more. So like I said, it's a minimally invasive procedure. It can be done in the office. I prefer to do it in a surgery center just because that's where you can get a little bit of sedation to have it, but you don't have to have sedation. You could actually be wide awake to have it. We can use local anesthetic, which cannot be done with a sling. We can just do this kind of just like you are right now. You could eat the morning of, all of that. And like I said, it's a soft water-based gel that's clinically proven to help improve or cure the stress incontinence. So this little video shows a little bit. Okay, so this is just a little cartoon of the urethra leaking, and I take a little tiny telescope and look inside, and I'm sorry if the lights aren't great here, but you put a little needle in and inject these little cushions in 4 quadrants, and you can see how the opening of the urethra that was wide open like the inside of a donut, it got tighter, and actually, you just visually, you can see it's like tightening a valve on something. You went from having a leaky faucet to a less leaky faucet. So it works very well. People are very satisfied with it, and it's very minimally invasive. So again, here's kind of another little cartoon of it. So you can see you put 4 little cushions in, and it helps to tighten that up. Now, many of you, I don't know if any of you go on Instagram or Facebook or those things, but you may see these women with these facial fillers and they have these gigantic lips and all these crazy things. This is a similar product to that, but if you were to have those injections done at a plastic surgeon, they last like 3 months. This lasts 7 years. So it's a pretty impressive product. I mean, you can't get too many things that are going to last that long with that little of an invasive procedure. I mean, it's a very simple thing to do. And it does not cause a reaction. It's not going to cause some kind of inflammation or irritation. It's a very natural product. Okay, so here's the key as to what to know. 92% of women reported being cured or improved following the treatment with Bulkamid. Okay, I mean, that's a very high statistic for a procedure. Some drug clinical studies only have 60% improvement and they still are able to give those medications to patients. This is 92% safe and effective. It's a very simple procedure. I would say in the surgery center where I tend to do it with a little bit of sedation, it might take 3 to 4 minutes to do. In the office, it takes a little bit longer just because kind of getting things set up and all that, but it's a very safe and simple procedure, less than 15 minutes no matter how you do it. And again, it gives you relief out to 7 years, and that's I honestly feel like that's almost early reports. I would be surprised if it doesn't even last longer than that. So it's a very safe option. You should know that it's available. You should also know that if you have a friend that leaks and doesn't do things because of leakage, they should know it's available because it takes a few minutes to do and can really make a difference with your quality of life. Okay, so now I'm going to kind of shift gears and I'm going to talk to you about a second part of things. So what I see a lot is I see predominantly ladies. I probably see 40, 50 ladies a day, and they all come in for leakage, okay? And I've been doing this for over 25 years now. So when you come in and you start to tell me what your symptoms are, sometimes they're really related to an urgency to get to the bathroom and you can't get there in time. And sometimes it's related to a leaky valve because you cough or sneeze and you leak because of like a functional problem. But most of my ladies have a little bit of a combination of both. It's just a matter of figuring out which one is the issue that's a primary problem. We deal with that and then we address the secondary problem. Or if you have just straight up one kind of leakage, we can deal with that. But know that the whole pelvic floor works together. So if the bowels aren't working right and the bladder's not working right, one or the other affects the function of the other organs. So sometimes if we treat the whole pelvic floor, we're able to do better than if we just treat one part. You know, your body is a lot of interplay. It's not just one thing. So I think this is kind of a nice slide just because this lady, Jill, was one of the chief medical officers for this company when it first started out called Axonics, and it became then a part of Boston Scientific, which you may know is a big company in the United States. But when she started out with Axonics, this patient was so pleased with her therapy that she asked to be on a commercial. So if you actually see a commercial for Axonics, this is the lady that's on it, and she's one of the first patients that had the device, and she was so thrilled with it, she wanted to be on TV to tell people about it because she thought not enough people knew. So this is Jill, and she's had some good therapy with the Axonics device, which I'm going to tell you about now. So we were talking about leakage with physical activity, cough, and sneeze. Now we're going to talk about the urgency to get there. But I'm going to talk about bowels and bladder now, okay? So when you have overactive bladder, and I'll tell you a little more about what that is, it's estimated that 50 million people in the United States have that. That's men and women, but that's a sizable number. And I mean, if you add that to the 30 million, that have the other kind of leakage, that's a lot. And then the other thing that I think is pretty impressive is to note that 19 million suffer with leakage of bowel as well. And that means inadvertent, surprising leakage of gas, liquid, or actual stool in an inappropriate time, not when you're sitting meaning to go, but when you're walking down the street or you have a sudden urge and you can't make it in time. The saddest part about this is that only half of people with these severe symptoms seek treatment. That's really a commentary on us as a medical profession, that we haven't gotten the information out to let people know that you don't have to live like this, you don't have to deal with this. There's a lot of safe, simple procedures you can do to improve that. So, okay. So I'm going to talk to you kind of just generally, and then we're going to kind of focus in. So some of the symptoms that you may have could be related to actually having an overactive bladder. Now, an overactive bladder is when you may have heard the commercial where they say, gotta go right now, and you can't make it. Well, many people are familiar with that, and we've all probably experienced it at one point in your life. But if it happens frequently and consistently, it's considered overactive bladder. You can have overactive bladder where you leak, and you can have overactive bladder where you just have to go all the time. And many times you go too many times at night. That's a really big complaint we get at our office. You can't sleep all night. You get up 2-3 times a night and it interrupts your sleep. So that's considered kind of an overactive bladder component. Some symptoms can be related to urinary retention. Now, on the opposite side of things, people that don't empty well enough actually kind of spill over like a glass of water draining. If you turn the faucet on and fill a glass of water and it just pours over, that can happen as well. So it's up to a doctor like myself to try and figure out what the cause of your problem is, because the treatments are a little bit different, but there is one common theme to all of this. And then for fecal incontinence, it's just the involuntary loss of stool, and I would say that qualifies with gas, liquid, and solids as well. It doesn't have to just be that you have a complete disaster. It could be that you have smearing and just don't know why it never stops, or you have some soiling that you were unaware of. Okay. So to understand how this works, we got to talk a little bit more about the normal bladder function. And I addressed this a little bit earlier, but basically these muscles, these are the muscles you squeeze with the Kegel exercises, are around the urethra, and they sit nice and tight and hold urine in, kind of like pinching off a valve. And the bladder should very calmly fill up to a certain amount, about 500 cc's. Most people start to feel it around 120 cc's, but you should be able to hold a good amount, kind of like the size of what that candle is on your table. So about that size is how much your bladder should hold. If it doesn't, then that's a sign that there might be something going on. Now, emptying of the bladder, what we need are these urethral muscles, the muscles around the urethra to relax, to allow the urine to pass through, and then the bladder has to contract to completely empty. Whenever there's a fault in any one of those systems, it makes it so that you might leak or not empty as well as you should. So, okay, so back to the overactive bladder. So it's the frequent and urgent need to empty your bladder. So you really shouldn't have to think about your bladder too much. If you think about your bladder or your bowels more than probably once a day, I think you're thinking about it too much. It should be a function that you don't need to, it should be kind of an automatic thing. You say, oh, I have to go to the bathroom, and you make it to the bathroom in time. You're not worried like that you won't make it in time. So if it's very obtrusive to your life, causing an issue, that would be a sign that it's an overactive bladder. And it doesn't have to be that you leak. You can just be going too frequently. So what is too frequently? The normal person urinates usually less than 8 times a day. So I tell my patients, generally speaking, you want to go about every 2 hours during the day. You shouldn't have to rush. You shouldn't leak on the way. If you're going more than 8 times a day, that might be a little bit frequent. Now, there's clearly things that make a difference with that. If you're on a water pill, you might have to run to the bathroom after you take that water pill for a little bit of time. But it still shouldn't be that you're leaking on the way. So less than 8 a day. Urgency is considered where you have that sudden urge and then you just do not have the time to get there. You should be able to feel the urge here and make it back to your apartment or wherever you are in this building and be able to go to the bathroom. If you feel like you can't, then that would be a sign that you're having to go too urgently. Incontinence is clearly what I said, just basically leaking. If anything ends up on a pad that you didn't want, or if you're even wearing pads, then that's a sign that you're having an issue. And then nocturia, that is where you get up more than two or more times at night. And this is the real, probably the thing that makes people the craziest at my office. They really hate getting up at night, and I agree with that. I think if you can make it a good 3-hour segment of sleep without having to get up, that's when your body restores, that's when you feel refreshed, you get your REM sleep, all of that. And when you are waking up every hour to go, you're not getting restorative sleep, and it affects your other health issues. You need to sleep well to be able to do well. And so if we can do something to improve that for you, that's going to make a big difference in your quality of life. We all do better the next day if you have a good night's sleep, and we all do worse when you don't. So I think that's just, common sense there. Okay, so because we're talking about the whole pelvic floor, I'm going to talk to you a little bit about the bowel, because it also does kind of play into this. So fecal incontinence, obviously being incontinent means you do it when you want to and it goes well when you plan to do it. But if you have a severe urgency where you just cannot make it to, you just always feel like you have to go really suddenly, that's not a normal function of the bowel. Obviously, when you leak stool when you don't mean to, that's an abnormal function. And there are some people, so in particular women that have had children, and especially if you've had an episiotomy or if you tore or the doctor cut you, a lot of times the fibers that go around the anal sphincter, they're like a circle. And when that circle is broken, those fibers do not sit closed the way they should. And so sometimes you just can't tighten. You could squeeze all you want, and you're just not gonna tighten it enough to make it so that you can hold it. So in previous years, we used to do a surgery called an overlapping sphincteroplasty, which was a surgery to kind of tighten those muscles up. What they found is that doesn't work. But we do have something that actually works very well and is less invasive than that could help. Okay, so to have normal bowel function, what we're looking to do is really focus on this area here, which is the anus and the rectum. So as the rectum fills with stool, you eat your food, it goes through the small intestine, it goes into the large intestine, across, down, and around. And as it gets down here, it stretches receptors in the wall of the rectum. So when your body says, oh, we're full, then it sends nerve messaging to the brain to tell you, hey, we should go to the bathroom. It's time to find a bathroom. And to defecate, to actually move your bowels, it's a similar process as with the bladder. The muscles around it have to relax, and then the muscles in the bowel actually push and squeeze things out. So again, we're talking about the good news here, not the bad news. I'm telling you a lot of things that sound terrible, but quite honestly, a lot of these things can be improved. And so if, let's say, you have any of those issues, if you have leakage with cough and sneeze, if you have an urgency to get there, you're getting up at night, you can't make it to the bathroom for either bowel or bladder, you want to start with the simpler things first. Now, as I understand it, you all are independent living, so you probably have your own doctors all around town that you see. You don't have a doctor that's just here, is that correct? Okay, so what you would want to do is you would always want to start with your initial physician, because they may know things about you that we don't know, obviously. You want to tell them, hey, I'm having an issue. And I know for some ladies, it's very embarrassing to tell a male physician that they're having issues with leakage, or they just think it's normal. But I would encourage you to make sure that you tell your doctor, because they can't do anything to help you or even refer you to anybody to help you if you don't bring it to their attention, okay? So please do. I mean, I can't tell you the number of patients that say, I didn't even know I could do something. And you can do something. So start with your primary doctor. And then they will likely start you on some treatments before you even to get to somebody like me. They might say, well, let's start adjusting your diet. Maybe you need more fiber. I mean, nobody's told that they drink enough water or have enough fiber, right? I mean, as a given, your doctor's gonna say, have some fiber, exercise, and water. So those things can sometimes make a difference. And maybe there's something very simple behaviorally you can do. Maybe you're lactose intolerant and that's affecting your bowels. Maybe you're drinking a pot of coffee every day and that's making you urinate all the time. Maybe you're drinking a ton of artificial sweeteners, which cause overactive bladder. Those things can be an issue. So you can just kind of cut those out by dealing with your physician. But if you don't get far enough with that, what I would encourage you to say is, go tell them that it didn't work. Because when they know it didn't work, if they don't hear you say, hey, it didn't help me, they won't know. They'll just assume it worked, and they won't know that they need to address this further. So make sure you let the doctor know that if it didn't help you, that you need something else. And that's where we come in with the advanced therapies. So a couple things that I think are interesting to know. So if you're going to your primary doctor, they may start you, let's say you have overactive bladder. You just have to run to the bathroom all the time, and you may or may not leak, but you're running to the bathroom. They'll start you with some of the physical therapy exercises. They'll talk to you about lifestyle changes. They may give you some medications. There's a number of medications out there now. There's kind of two flavors that we have available to us. Some are better than others. But as you may know, many of them are not covered by insurance or not covered well by insurance. And then you're kind of put into a class of medications that may not be good for your memory, may not be good for your health. So be careful when you get a medication that you know what you're taking. And then the other thing I would say, know what it costs, because you'll be shocked sometimes when you go to the store. But the other thing is 80% of people with overactive bladder actually discontinue medication within a year. And that can be related to side effects, it can be related to costs. And it's important to know that if you're also just not a fan of taking medication, you don't necessarily have to do that. There's these other things. So the initial therapy is also just for urinary retention. There are also behavioral medications. Alpha blockers are more for men with prostate issues like Flomax. Maybe you have husbands or friends that are on Flomax. A lot of men are. That's not as relevant to women. And then also for bowel incontinence, the things would be like the dietary changes I mentioned too. There are some pelvic floor exercises, and then there's some other things that are just not super successful. But when you get through those and you do those, or even you go on the internet and figure out what you can do for yourself and it hasn't gotten you where you want to go, then there's these advanced therapies here, and that's where I kind of come in. So for an overactive bladder, for a bladder that will not behave, what we do is we have a few options. We have tibial nerve stimulation, which I'll talk about. We have sacral neuromodulation, which is my favorite, and then we also have Botox. So again, not to pick on people on the internet, but you know the ladies that their faces don't move at all, that's Botox. And we can use that in the bladder. It actually works fairly well. The problem is it has to be re-injected frequently, and so there are some other complications that can occur with that. But what I want you to notice here is the common theme across all of these problems, fecal incontinence, urinary retention, and overactive bladder, which you would think are opposite problems, the common theme is sacral neuromodulation. So we know that getting the nerves to work correctly can help the whole pelvic floor to work correctly. Okay, so this is just an example of that tibial nerve stimulation. So believe it or not, there's a reflex that occurs when you access the tibial nerve, which is down by your ankle, with a kind of an acupuncture needle. And we can stimulate that with a gentle electrical impulse, and we do it once a week for 12 weeks for 30 minutes. So it's kind of like, you know, you start to have a relationship with our office, you're coming in for 30 minutes for 12 weeks. And it does show some improvement after 5 or 6 sessions to improve the way the bladder functions. The problem is, it's a lot of time on your part, it's a lot of patience on your part, and it's not always something that lasts a long time. You have to stick with it, and then you have to kind of keep doing maintenance. So I feel like if you're going to do something like that, there's longer lasting things we can do that might be helpful for you. But it is an option for sure for somebody who's not interested in going further. This is the Botox I was talking about. So what we do is, again, we do a lot of things through scopes. So I take a little scope and look into the bladder, and I take a tinier needle, and we put, it's a different number for different people, but basically it's about 20 little injections of the Botox toxin, which is the partial paralytic of the muscle. And it needs to be done about every 6 months. Now, 60% of people discontinue doing this after 2 to 3 treatments, and there's a number of reasons for that. So 1, they may not get good enough response. 2, they may get too good a response, and they have to catheterize because it works so well they can't pee, but like the muscle just stops squeezing, and then they have to just wait for it to wear off. And the other thing is it does increase your risk of urinary tract infections. So if you're somebody who's already getting urinary tract infections, and then you throw some Botox into it, you're more likely to get them, and it's just not a good fit for everybody. It can be done in the office, or it can be done, again, I like to do things at a surgery center because I'm not interested in torturing people, but you can certainly do it under local anesthetic if you wanted to. 20 injections is a lot to sit through, but I would always say that my toughest patients of all time are ladies over 60. If you have a 15-year-old kid, they can't sit through anything. A lady over 60, she could do anything humanly possible without any anesthesia. I think by far the toughest people going. So let's talk about some of the advanced therapies. Now, the thing that was the common theme across the bottom was the sacral neuromodulation. So this is a little cartoon kind of talking about it. So the spine is here, the bladder is here, the sacral nerves come out and kind of go down to all different organs down in the pelvic area, but specifically the nerve that comes out of sacral foramen 3, so this kind of nerve here, is one that goes to the bowel and bladder as far as sensory and motor function, okay? So what we know is that when we're able to stimulate that nerve, we are able to restore some of the normal function of the bowel and bladder. So not only do we get the benefit from incontinence of the bladder, we can get the benefit with the bowel. What I really want to emphasize to you is that this is something that more and more people are qualified for. It's really something that if you decide that medications are not the right thing for you, or they're too expensive, or they cause you side effects, or you just don't want to take a medication for the rest of your life, because if you stop taking the pill, you're going to have the symptoms. This is an option that is AUA and SUFU. It's got a specific indication saying that if patients, this is what the patients have done and they've tried the conservative therapies and they haven't improved, this is something that's an option for you. It is FDA approved for many, many years. We have over 20 years that the FDA has approved therapy like this, sacral neuromodulation, and it's also covered by insurance. So there's nothing elective about it. It's not like a plastic surgery this is something indicated and works well. What I love about it is there is a trial procedure to see if it works for you. So you can just, it's kind of like if you want to buy a car, you just go and you test drive it. This is like a test drive. So let's say you were to come in my office and say, okay, well, I have some urgency, I can't make it to the bathroom, I'm wearing 6 pads a day, I get up 3 times a night, I'm tired of it, I've tried these medications, I've tried physical therapy, nothing's worked for me. I'd say, let's try a test to see if it works for you. And if you were to try the test, what I do is, again, I take you to the surgery center, not because you need anesthesia, just because I like to use an x-ray to get it in the right position. We take a little tiny wire, and it's about the size of angel hair pasta, super thin. I use some local anesthetic, and I place it beside that nerve after it leaves this kind of the spinal area and goes down towards the bladder and bowel. Then we tape an external lead to that area, and you try it for 3 days. We usually do it on a Monday, and then we see you on a Friday, and you've tried it for those days. So let's say you were having all those symptoms, 3 pads and 6 pads and 3 times a night, and then we've taken a little diary of what's happening, and then I see you after you've tried it, and you say, oh, I only used 1 pad, and I was able to sleep through the night. Then we say, you're a responder. You're somebody who's going to do well with this. Then we take it out. You're no different than you were before the test, and then you tell me if you want to do it. I will tell you, our success rate at my office is 94% from converting people from when they do the test, provided I think they're a good candidate for the procedure, and to when they go to actually doing the implant, because they're so pleased with the therapy and what it was able to do for them. Now, I will tell you, nothing is absolutely perfect, but I will tell you there are a number of patients that haven't been able to become dry with this and be able to restore their normal function with both bowel and bladder. So it's a really good option. So again, this is Jill, and this is Melissa, who I think is even more brave because she had fecal incontinence. And to go on national TV and tell the world that you had fecal incontinence and this solved the problem tells you how passionately she feels about it and how helpful it was for her. So I guess the slide here is indicating that they're able to go for a hike without wearing pads, so that's a good thing. So again, going back to kind of a little bit of I got a little ahead of myself here. So what is axonics therapy? Axonics is just kind of the overlying name for the therapy brand, which is nerve stimulation. So much like, I'm sure, I don't know, maybe some of you have a heart pacemaker, but if your heart goes too fast or too slow, a pacemaker helps it to regulate. It starts to get it on a normal rhythm and normal rate. That's what this does for the bladder and bowel. It gets to restore the normal rate and rhythm of kind of how the bladder and bowel works. And because we're going beside the nerve that goes to both, you get the benefit in both. If you don't have a problem, it doesn't cause you to have a problem, but it does help to restore the messaging. So it is indicated because it helps, if it goes too slow, it helps to get the bladder to work better with urinary retention. And if it goes too fast, it helps the bladder to slow down to behave more normally. It also helps with the fecal incontinence because, again, the nerves are kind of working in a similar fashion there. So I kind of got ahead of myself again with this, but basically it's just regulating the messaging, okay? So somewhere along the line, the bladder and the bowel got out of control. Somehow the messaging coming from the brain that says now's not the right time is not getting to the bladder and bowel and calming things down. This is really just acting like a little relay station to correct that messaging. Okay, so this is what I was talking about with the little test. So it takes just a few minutes. Some doctors do it in their office, and on occasion it can be done in the office. I prefer to do it in the surgery center because my accuracy is much better with placement, and so I know I have it in exactly the right place. And I also like to do it in a sterile environment, but it can be done in the doctor's office. And I just think it's really an amazing option to be able to test something. Because if you're not so sure it's going to work for you, nothing's going to tell you it's going to work for you more than if you actually try it out yourself to see if it helps you. And that's just, like I said, a 3-day trial, and then when you leave on Friday, you're exactly the way you were on Saturday before you came in. So now, if you actually decide that it does help you, and you say, hey, I'm using less pads, I'm definitely at least 50% better, and I say, you're a responder, would you like to go forward? There's a couple options. So this company, Axonics, has been very forward-thinking with things, and what they have done is taken a technology that was available and kind of perfected it in a way to make it very simple to use. I kind of equate it to like regular old computers compared to the Apple, where at the Apple it's very intuitive, you can push just a few buttons, and with an old computer you have to do a lot of things. This is a super simple device. Instead of having kind of a computer type device, you just get a little thing that looks like a key fob if we do an implant, and it just has an up, down, on, off button. I mean, it can't get any easier than that. We have 2 options of the implants, and the implant kind of goes under the pocket area in the buttocks cheek. It all is underneath your skin, so you can swim, you could run, I have had people that have run marathons with it. There's no limitations after implantation, after it heals. And then there's 2 choices. There's a little bit smaller device, and this gets recharged. You place a puck on the outside of it every 6 months. We send reminders to do that. And that lasts for up to 20 years. I mean, 20 years, like what lasts 20 years, right? And we have an option that lasts 15 years that you never have to recharge. So I feel like the cell phone company should really take a lesson from Axonics on this, because if you didn't have to charge your phone for 15 years, that would be a real bonus. This is something you don't have to charge for 15 years, basically, depending on how high the settings are, which is basically, you know, I mean, a lifetime, right? It's a slight bit larger, but you do not have to recharge it. It has the same controller, and it is, no one would know you had it. If you had a bathing suit on, no one would see it. It doesn't protrude. It's a very discreet implant that doesn't take long to place either. So we do have a patient controller, and the main thing for this is, if let's say I think about it like turning on a radio. Let's say I decide, I think you want to listen to a certain channel and I put it on, it's not what you want. We can switch the channels, right? We can get it so it's a channel that works best for you. And sometimes, even though we get you on the right channel, we have to tune it a little bit to kind of fit what your needs are, to kind of see where your symptoms are. So if we put it in and you say, oh, I'm not as good as I was with the test, I want to adjust it, we can adjust it from outside with a remote control. You also get a remote control, but it's a very simple handheld one. You don't even ever have to touch it, honestly, if you don't want to. But the reason we also give it to you is because previous implants have not been MRI compatible. So it's a big issue, especially in the older population with falls or strokes or anything like that, that you want to know that you can have an MRI. This is MRI compatible. You can have an MRI of your knee, whole body if you need to, and all of the facilities in this area are aware of how to deal with it, and they also will reach out to us if they don't know what to do. So there is this little button in the center here. You can hold it down for 30 seconds, and then you can have an MRI, and then we can turn it back on, and you can go about your day. In previous years, as long as I've been doing this, there were times that we would have to actually remove the entire device from a patient just so they'd have an MRI, and it was a real waste and a shame if they were having good therapy. So again, I got a little ahead of myself here, sorry, but you know, so you have full body capacity to have an MRI, which is really important. And if you're going through the airport, I can tell you Southwest Florida has very few people that can walk right through, because you always have to get the wand for either a pin in your leg or a knee or a hip. But this is something that if you're in the one where you stand like this, I believe you can just stand like that. We give you a card to say that you do have an implant in your body. And then some people do have to get the wand, but it will not preclude flying or anything like that. We would make sure that's okay. So again, we're talking about really high numbers for success. It's meaningful, and the key is it's lasting improvement, right? We're not talking about 4 or 5 months. We're talking about 15 to 20 years. And 93% of patients achieve clinically significant improvements in incontinence, and that's at 2 years. So that means that we know that it lasts for quite some time. And we have studies that go out further than that, but that's just where that study was. So 2 years after implant, what we're showing is that over 90% of patients were still satisfied with their improvement, and 93% would go through the therapy again, expecting even the same results. So that kind of speaks for itself as to how successful and how helpful it can be for people. So again, here's Jill, who's very happy with everything. And it is just important to know that if your quality of life or someone you know is having issues with their quality of life related to this, it is an option for many people. And it is something that it's well worth kind of checking into and seeing if there's somebody that can help you with it. So, so with that, I'm going to kind of open it up to questions. If anybody has any particular questions that I can answer. Obviously, I'm not your particular doctors, but I mean, I'm happy to answer any general questions you might have about the bladder, the bowel, Axonics, any of that.